Type 2 diabetes mellitus comprises of increased blood sugar levels as a result of insulin resistance or impaired insulin secretion. Diabetes is a chronic disease that occurs following metabolic impairment. It is increasing at an alarming pace worldwide, and it is estimated that by 2035, almost 600 million people will be affected by this disease. Various research studies have proved that a balanced, healthy diet and following a proper physical regime can reduce the risk of developing diabetes by about 40%. With the intention of preventing diabetes becoming a global epidemic, many researchers have been working on identifying the dietary factors that may play a crucial role in reducing the incidences of developing type 2 diabetes. Many studies have established the fact that modest dairy consumption may be associated with reducing the incidences of diabetes. Calcium, an essential mineral and an important component of all the dairy products, is required for insulin secretion and is actively involved in the mechanism of insulin action by controlling the calcium levels within the cells. One of the studies conducted on the Korean population, published in Korean Genome and Epidemiology Study and observed for 10 years, has demonstrated an inverse relation between dietary calcium intake and risk of type 2 diabetes. There have been numerous other studies that have been conducted in the United States and Europe that have revealed the association between calcium-rich food intake and risk of diabetes development. It has been observed that a total intake of more than 1,200 milligrams calcium and more than 800 IU vitamin D is linked with a 33% lower risk of type 2 diabetes compared with an intake of less than 600 milligrams and 400 IU calcium and vitamin D, respectively. This suggests that calcium plays an important role in the prevention of type 2 diabetes. Though calcium deficiency is difficult to document, it has been a matter of concern as people are not consuming the recommended intake for calcium. Enough research has been done to demonstrate that altered vitamin D and calcium equilibrium in the blood may play a role in the development of type 2 diabetes. Most of the observational studies have contributed towards the consistent association that exists between low vitamin D status, calcium or dairy intake, and prevalence of type 2. Along with calcium insufficiency, there are evidences that vitamin D deficiency may negatively influence blood glucose level, concluding that combined supplementation with both nutrients may be beneficial in optimizing glucose metabolism.